Hello, and thank you for joining us. My name is Mirapelo Letebele. I'm the coordinator for the Selalelo program. I'm based in Mankodi in southern Botswana. This program is sponsored by MORE, the Movement in Omaha for Racial Equity. Selalelo exists to listen very, very carefully to women's lives, their stories, and especially where systems are under strain and voices are often missed. We work across communities, borders, and we share stories that rarely make it into policy rooms and headlines. But we know that women are not mere statistics. We talk about stories that shape women's realities every day. So, this is our first program for 2026, and we begin with listening beyond our borders. I'm very excited to have Shillah Tiitwe from Uganda with us today, and our conversation will center on maternity care, women's dignity, and basically, since she's a midwife, what nurses witness at the most vulnerable moments of life. Women are not statistics. She has experience and she'll tell us about other women's experiences as well. Welcome, Sheila, and tell us a little bit more about yourself.
Thank you, madam. I'm called Tiitwe Shillah. I'm an assistant nursing officer working with London College of St. Lawrence. In holidays, I'm working with the health centers within the Uganda doing some counseling. Most times I'm working with our ladies. Right now, I'm based in Rukunjiri district, Rujumbura County, Nyakajemi sub-county within Uganda. I'm happy to be hosted by you, madam.
Okay. Yeah, I'm going to need you to pass me a little note about all those names so that I can get them correctly. And now let's talk about
Okay.
maternal health, Sheila, and childbirth realities in Uganda. So what are some of the common complications that you see during pregnancy or childbirth where you work? Is your place a rural place or an urban one?
It is a rural place
Mm-hmm.
on a level. It's a rural place.
Mm-hmm.
It is.
Mm-hmm.
So the complications, back to the field, the complications we encounter in the health facilities in Uganda, we encounter the complications of anemia, infection during pregnancy, infections those are malaria, urinary tract infection, that is UTIs. Then during delivery, we encounter during delivery, during pregnancy, we are encountering complications like eclampsia, that is high blood pressure with the infections, of course. Then during delivery, we are encountering complications like complications like postpartum hemorrhage. That is the first one. Then maybe we've got, most of the time it's always postpartum hemorrhage. Then after labor, we've got sepsis. Again, that is a complication, that is infections and others. There are so many, but those are some of the ones that I can give you right now.
Hmm. So, as a young lady, have you ever had the horror of witnessing maybe, a patient dying due to maybe postpartum hemorrhaging?
Yeah, actually, postpartum hemorrhage is one of the leading cause of mortality within Uganda, and we have encountered some, maybe nursing them with the help of the doctor, but it's one of the causes, but the government is trying maybe to put something on it, but I've ever.
Hmm. So, the first time you saw it, can you just tell me how you felt about it? Were you scared or were you ready because you received training?
Actually, you've reminded me something.
Hmm.
Actually, the first time I encountered a mortality, actually, it was due to postpartum hemorrhage. But I
Hmm.
can remember actually everything, that story. I was still in the school of nursing by then. I was still doing my certificate. And I was still young to the field. And there are those emotions. This was the lady who had, actually, she was roughly 48 years. She had done this. She had got Nanka, is it? I'm forgetting it, sorry. But she had used the artificial method of conceiving. I wonder why I'm skipping.
IVF.
IVF, that's what I meant. So she had done IVF and she had got a beautiful baby. Those were 2 boys and 1 girl. Because she never had a husband. So she was like, let me get kids. So this is the lady that gave birth, that was operated well. Then later she got a postpartum hemorrhage, of course. She died and left the kids. It was so terrible. The hospital was it was just all the hospital was in tension. I can remember. I was like, how I wish she didn't even try. So there is that. It's not good. Actually, whenever there is a mortality within the country, even up to date, there is always that tension within the country. It's different from losing a man, sorry to say, or losing even a lady who has died of malaria, not giving birth. But whenever a lady dies when he's giving birth, there's that tension it creates within the country. Everyone feels it, that pain.
You know, my skin is just crawling now as you are saying that, because I am so scared of childbirth.
There's a way it feels. Everyone, even if you are the enemy, you will feel that pain. No one wants to die in labor.
That's not nice at all, because it's like the people who make decisions for us don't understand that giving birth is a matter of life and death. And we need reform in maternity clinics and hospitals. Anyway, we can move on to the next question. So, are there moments when, when a woman needs medical attention, but the system cannot provide it?
Yeah. Yes. We encounter those scenarios or those cases. For example, you will receive, let's first start from the family planning. A lady comes in for family planning services. She came in her mind unprepared. She wants an IUD, an intrauterine device, or she wants an implant. But the implant is not available, and it has not been supplied for years in that health facility. Meaning that most of the time you find a health facility has always used contraceptives. And first she prefers an IUD. So you find like you have nothing to do because it's not in the system. There are cases where you find someone is sick, a mother comes in when he's sick. Maybe there is bleeding, or there is a cut somewhere, you need to stitch. You have the skills of stitching and you arrest the bleeding, but you don't have the requirements necessary for stitching. For example, sutures, sterile equipment to use, because you're not going to use anything, you're going to cause sepsis to this lady in the course of helping. So but in those cases, most of the times, if the system cannot support, we refer to where we think they can find, or to where we know they will find the services that they wish to have.
Yeah, that is very sad, because currently, even in Botswana, we are experiencing that, where the hospitals are not adequately stocked, but it was because of corruption, not because of anything else. The people who were entrusted with supplying those things to the nation did something else with the money. So it's very, very painful, because especially if you have to lose mothers in the birthing room, I think that is the worst thing ever. So anyway, now what kind of emotional toll does this work have on you as a nurse, especially when the outcomes are poor? You could have saved a woman's life, but because maybe this medicine or this device wasn't available, somebody had to lose their life. What does that do to you as a nurse, and what do you do to support yourself mentally?
Being a nurse, I remember when we were in the school, they told us being a nurse, not everyone can become a nurse, not everyone can become a midwife. It's always a calling. And there is always that inner part that pushes you, whether you're paid or not. You feel like there is that as you want to save a life. Someone has come to you, like someone needs services from you. And you feel like according to your skills, you can provide. But due to shortage of either resources, you cannot provide them. It's so emotional draining for the nurse not to deliver the intended services or the required services. So it's so emotional draining and stressing mentally, both mentally. You feel like you feel like you want to help, but you can't. So it's
I
so stressing and
understand.
emotional draining. That's what I can say.
Yeah, in
Because
the
every
past,
nurse wants to save.
yeah, yeah. First, do no harm, I'm sure it even applies to the nurses. So, in the past, I spoke to a lady from Uganda, but she grew up in Botswana. So she has a different experience than you, even though she was Ugandan. And now I just want us to talk about women's rights and dignity and respect in Uganda. Since you've never been to Botswana like Kathy, but as a woman, do you feel that women feel safe and respected when they come to give birth, regardless of age and marital status? The reason why I'm asking you this is because in Botswana, we have the services, we have the clinics, we have the midwives, but they treat us horribly. So, in your experience, how is it over there? Do women feel respected?
No, the respect given to these ladies, it's not equal.
Mm-hmm.
I have to be sincere with you. The teenager who gets pregnant, the respect and the services she gets, or even the services she gets from the beginning, they are different from the other one who is of age. There is that, the health workers may take it, maybe there's that overload. Maybe if she didn't get herself pregnant, the workload would have reduced or it would have been minimal. They feel like there's that increased burden or increased workload due to unseriousness. Most of the times, these teenagers who get pregnant, they come in late. So there is the reaction is always different.
Is
and
it
the
because
respect is
it
different.
because
Even within the community.
Is there a stigma attached to teenage pregnancy?
Yeah, there is stigma to teenage pregnancy. So, like, even within the society the society does not treat them the same. So there is always that stigma. There is always that. It's there. It's not equal. The support of the teenagers, it's not there. But though some nurses try to give it, to counsel them, to be with them, to support them, but it's not equal.
Okay, so now in that case, who is there to speak for the women when they are in pain or when they're too weak? Who's there in Uganda who speaks for women?
When the nurses try to advocate for these women, for their rights, they try to advocate for them, but it's not all that much. Like the implementation, they can advocate and they raise issues, but the implementation is always from the upper cadre or from the top to down, and the nurses will find themselves when they are down. But they try, and there are other women organizations within the country that try to fight for the ladies. But being like we are the ladies, they are not, the advocacy is done mostly by the nurses and the women organizations within the country.
Okay, so are there any cultural beliefs that still put women at risk during pregnancy and delivery? Are there any cultural
Yeah.
beliefs? Like what?
There are still some communities, for example, the pygmies within also the Western region, that is, maybe we can say Kanungu, we've got the pygmy to go for health care services. They still feel like they should stay in the bush and they nurse their ladies from there whenever they are sick. That's hence here and hindering the health services. These ladies, they are nursed everything from there. We've also got the religious part where the religions also stop them. They are like, God gives everything. You pray and God will work it out. You don't need to go for any health services. There are also other groups where we've got traditional birth attendants who also the families believe that traditional birth attendants, they are the ones that know best during pregnancy and during pregnancy with the issues of the ladies. So with such a beliefs, there is hindrance to the LSF facilities, so they are still there. But the population, though, it has reduced compared to the one that was before.
Okay.
I may say.
Okay.
If it was the other time, if it was 80, at least now I think the population can be 30 over 100, the one that choose the cultural beliefs.
Okay. In Botswana, we have a serious problem. Women in Botswana are facing a major crisis, and I can call it a silent emergency, where men just slaughter their partners, their women, their ex-girlfriends and ex-wives. They just kill them, and sometimes they even kill the women's children too. So I'm just wondering how things are in Uganda. Have you seen cases where violence, maybe abandonment, where the men left? Do these things ever show up in the maternity ward? Do you ever see women who are pregnant and have been victims of crime?
Yeah, they are there. There are some ladies, maybe due to rape, some lady was raped, some maybe there are some cases where you find, we've encountered cases where you'll find, like, for example, in the teenagers, it was this young girl, there is a young girl, you find like it's a young girl, she has been staying with a guardian who is an uncle, maybe the uncle uses her, gets her pregnant, then after chases her from home. We've also encountered cases of mad people, mad ladies who are on the streets getting pregnant, meaning the right people, the sound-minded people, they are men, they are the ones that are getting these ladies pregnant. But remember, these ladies, they don't know who has got them pregnant.
And
so we've also
do you think in cases like that where somebody has mental problems and they show up pregnant, do you think it would be a result of rape or something else?
I would say it would be a result of rape, because I don't think that mad person would consent for it, because they are not in their sound mind. They're mentally ill patient. Actually, we don't call them mad, they are sick. So someone who is mentally ill can never consent for any intimacy unless, and what I know, I don't think the mentally ill person will be the one to impregnate this lady. So it's always rape. And again, some patients, when they are sick, their libido is high. So they might also look for men. But if someone is in sound mind, if a man is in sound mind, you have control over your body. You can restrain.
Yeah.
You can avoid her.
But that is a crime, surely, right? Even though they cannot know who the father is, it is a crime. Okay. Now,
it is a crime, but it's hard to get the culprit.
Yeah, I understand. So, Shillah, are you worried that the world may be sliding into World War III?
Why?
No,
Come
I don't
again.
know. Huh? You're not sure? Okay.
The what was it? Come again about the question, madam.
No, I'm saying, do you think the world might be headed for a world war? Because the superpowers in the world are fighting, they are doing some things that we in Africa don't understand. Do you think there's a threat of instability?
I'm a Christian. Being a Christian,
Hmm.
I always believe in God. I believe in God most. And I'm not a person who follows up a lot. Nowadays, most of the times, actually, I spend my time within. If I'm not helping, if I'm not working, maybe I'm at home, maybe I'm at church. So I'm not afraid of that word. I don't think it's there. So yes,
Okay.
it may not be there because God is in control.
Okay. So if you could change one thing tomorrow, okay, one thing that could save the women's lives, what would that thing be? When, in childbearing situations.
In childbearing situation, I think I would choose education, educating these ladies. If I think the complications and everything that we've encountered so far, if these ladies are educated from down, wouldn't be facing any problem. If there are facilities to facilitate the programs, and maybe these ladies are educated from down, and most ladies, and everyone gets their education. And again, if the facilities, for example, the health facilities, they are well equipped with medication, with enough staffing, because in Uganda we've always faced a shortage of staffing within the health facilities. I think I would start by mostly educating, making them aware about safe motherhood, letting them know about the importance of visiting the health facility. And I think education would be better than anything else.
Okay.
At least if they know, even if it's a government hospital and there are no services, at least they would try and they choose a private hospital.
Yeah.
As long as they get the better care, since they will be informed.
Okay. Well, let me ask you the very last question now. What message would you like women across Africa to hear from nurses like you? What is the one message that you want women to hear? It could be about anything.
The message I give to the all ladies out there in the world is to love themselves. Then let them embrace Western culture services. Western culture, we mean in Uganda we call it the
Western medicine. You mean Western medicine, yeah.
Let us not. For example, to the Christians, I may say I'm a Christian, but let them not stick to God for everything. Let them know God also created the Western medication. Let them go for it. And let them, how I wish they all get informed. If there is any teaching nearby, let them go for them. Let them all attend antenatal care. Antenatal care is the first step to safe motherhood, to safe delivery. That is 3 months before conception. If it's possible, let every lady visit before conception, before you plan to get pregnant. First see the doctor or see the health worker that is near you to prepare you for conception. Then after conception, during the 3 months after conception, the first 3 months, make sure you attend them. And like you finish the antenatal care, then let every lady give birth in the hospital setting, no matter the circumstance. Let them get equipped, let them love themselves. Their lives matters most before anything else, because that is their life. So that is the message I can give to them, and thanks for listening to me.
You know what, Sheila? Thank you so much. You just opened my eyes, like my third eye just got opened because it's amazing how African countries are going through the same things at the same time. But the reason for this conversation and many others like it is that at least if we keep on sharing information, getting to know each other, we can appreciate circumstances, and maybe in the future, when we are able to, we can extend a helping hand to each other, to all the women wherever they are. So thank you so very, very much for talking to me. And I hope to have other conversations with you and others in the future in Uganda. So I'm also wishing you a prosperous 2026. I'm hoping that everything that you touch will turn to gold this year. Thank you very much, Sheila.
Thank you so much, madam.
Mm.